every single day, 'cause I love my occupation.
That's true. I do love my occupation. What is it? It's occupational therapy. You might be wondering, what does that mean? Well, according to the American Occupational Therapy Association, occupational therapy practitioners ask, what matters to you? Not, what's the matter with you?
That's right, Alyssa. We as occupational therapists believe in working with a holistic approach towards persons that we are treating, providing interventions that focus on their occupations that are meaningful to them.
But what does that mean?
We look at a person in a holistic approach, meaning we look at the person as a whole, their physical, their cognitive, their spiritual, and their emotional abilities.
Everyone deserves an equal opportunity to participate in the occupations they want and need to. Let's go ahead and take a look at some of the types of people we work with and kind of the environments we work in. Here you see an occupational therapist working with a 2-year-old in an outpatient pediatric clinic using play therapy as a modality.
Here you see an occupational therapist with an 8-year-old in a school setting working on handwriting to improve their fine motor skills.
Here you see a 35-year-old woman who suffered from a traumatic brain injury. She's developing the skills needed to prepare a meal independently in her home with an occupational therapist.
Here you see a 7-year-old woman who had a right total hip replacement, learning how to use a walker for assistance with the occupational therapist in the hospital.
The philosophy of occupational therapy is that occupations may be used for health promotion and wellness, remediation or restoration, health maintenance, disease and injury prevention, and compensation and adaptation. The use of occupation to promote individual, community, and population health is the core of occupational therapy practice, education, research, and advocacy.
Equality is significant because all people deserve the same standard opportunities, no matter their ethnicity, disability, or beliefs. We need to respect people's choices and lifestyles even if we do not agree with them. Freedom is important because it allows a person to establish their independence and make their own choices. As an occupational therapist, this is essential to listen to a patient's goals when creating treatment plans. Justice places value on moral fundamentals of fairness, truthfulness, and equality. As an occupational therapist, it is important to have knowledge on the legal rights associated with practice. Altruism is having concern for the well-being of others. Truth is valued as an occupational therapist because you need to be accountable, authentic, and honest with clients to form meaningful relationships. Dignity is essential because as an occupational therapist, you need to be able to value your own self-worth in order to provide care to other people. Also, when treating patients, occupational therapists need to be able to recognize each person's unique qualities and how it can change treatment plans. Lastly, prudence is the ability to have rational thought and use reason to come to conclusions about situations that are presented while treating clients.
Today we talked about the philosophy of occupational therapy, the core values, settings that we work in, and the populations.
We hope you enjoyed learning about this profession that we love so much. Go OT!